Would also like to invite Dr. Anil PG, Director of Medical Services, Cluster 1, Apollo Hospital, Chennai. Can I invite Dr. Siva Prasad, Unit Head, Apollo Hospital. With the ceremonial lamp lighting done, we'll now cut across.
Today, Apollo Hospitals is launching Always Open, Always Here, a first of its kind initiative that brings routine and planned healthcare from consultations and diagnostics to preventive health checks and scheduled procedures to all 7 days of the week, including Sundays. One more day to care for you and for your health. And this is a national movement. Even as we are gathered here in Chennai, our colleagues and members of the media are gathered in Delhi at the same hour, where Dr. Pratap C. Reddy, our founder and chairman, will be leading the announcement. Can we now cut across to the field in Delhi to witness the gathered proceedings?
To you at the Apollo Hospital, always here and always open, ladies and gentlemen. Thank you so much, sir.
Ladies and gentlemen, can we have a big round of applause? There it is, always open, always here. Follow sea of service to every Indian, every single day of the week. Can we have a bigger round of applause? Those clinical excellence, where we provide quality healthcare across the month, across the year, on Sundays as
well. The system can adapt itself a little more to the lives of the people it serves. So in just a few moments, we will unveil that commitment. What an honor, ladies and gentlemen, to have with us today a distinguished gathering that reflects the many stakeholders who are part of the healthcare ecosystem. Our doctors and healthcare professionals, diplomats, corporate leaders, partners, friends of Apollo, and members of the media. Thank you all for being here. All the Apollo hospitals are ready to launch this new initiative. So in just a few minutes, we shall have Dr. Preeta Reddy, Executive Vice Chairperson of Apollo Hospitals Enterprise and a founding member of Apollo, to speak to us.
Dr. M. Srinivasan, member Niti Aayog, our respected chairman, dignitaries in the audience, my colleague at work, Sangeeta and Sunita, many other senior doctors who are attending today's function, dear members of the Apollo family. And when I say Apollo family, I'm actually talking about almost 200,000 people who have come together in multi-locations for this initiative with a single-minded agenda to just serve the people of our nation and to set a standard and a benchmark throughout the globe. And I think that is what has made today significant and it has made today special. After all, healthcare it's about caring, it's about focusing. And I think every milestone we reach, every step we move in the right direction is in that single pointed agenda of doing whatever we can to raise the bar on the delivery of healthcare. Always open, always here is a global first. It was conceived by our chairman, it was thought through by our chairman, who in his earlier days said that the emergency room should never be, it used to be called a casualty room, and he said it should never be a casualty, it should be an emergency room. Healthcare has to be able to reach every individual who needs it. So Apollo Hospital was born from that dream. What can we do to serve the public better? There was telemedicine, many other initiatives. But today's initiative is far more far-reaching than all that we've done over these years. And it truly is a global first, because nowhere in the world do people commit to the fact that all services will be open on a Sunday? All services will be available to people on a Sunday. And you may ask us, saying, anyway, they're the emergency rooms. But it's precisely why we don't want an emergency that always open, always here is being launched today by our chairman. It will have all services available to people. It will have the emergencies available, but anything which they need, which they don't have to wait for, a week slot, will come over the weekends, especially on Sundays. And this is significant because in today's world, there are busy executives working 24/7, and they really wonder, how will I take my aging parents? How will I take my child to the pediatrician? How will my wife really get that consult which she needs unless I take off from work? And that becomes a reason to push things further and further till there are emergencies. And for this reason, we're saying that please don't wait, because events don't wait for anyone. Your health is your most important asset. We are there to serve you, and that is why we are available. We are always open. We are always there to serve you. But what is delightful is today, the entire Apollo system, which is 80 plus locations, multiple pharmacies, clinics, are listening to what we're saying. So we will start by keeping the hospitals available on Sunday for routine work so that people don't have to wait. We will start by saying that we encourage you to take your preventive checkups. Don't wait for the weekdays and taking time off from work. We're there on a Sunday. Come as a family and prevent the onset of disease. We are available for you anytime if you want to call us in need. So I think this is what Apollo commits to, and it is probably one of the most significant announcements, launches, pledged by the entire Apollo family to raise the bar, to push ourselves further to deliver what we have to do. So I really want to thank the members of the media who've supported us in our journey for over 42 years. And today, all of you have been there to let people know that, healthcare is available to them. They don't have to wait. They don't have to hesitate. And of course, I have to thank our chairman because he doesn't stop pushing us. And there was somebody who said that he doesn't know English because he doesn't know the meaning of the word no or not possible. So thank you, Chairman. The entire Apollo family of over 200,000 people are committed to this vision and to this dream. And to our friends who are there, thank you for your support and for being there. Namaste and Jai Hind.
It is life's mission to bring world-class healthcare within the economic and geographic reach of millions. When in 1983, Dr. Reddy embarked on a journey that transformed Indian healthcare through Apollo hospitals, he not only pioneered private healthcare in India, but also challenged the very idea of what was possible, bringing world-class care within the economic and geographic reach of millions. That model, the Apollo model, sparked an entire healthcare ecosystem. And today, more than 300 large, high-quality hospitals have helped raise standards, expand access, and bring advanced medical care closer to people, often at a fraction of international costs. So what began as one man's vision became a movement that changed the way India accesses healthcare. And what is most remarkable, as was mentioned by his daughter, Dr. Preeta Reddy, Dr. Reddy's story is that the vision has never stopped evolving. Even today, he continues to work tirelessly towards the original dream to make world-class healthcare accessible to all. And today, Dr. Reddy is here to share a novel and forward-looking concept in caregiving, one that begins with a simple but deeply human understanding that healthcare must be accessible when people need it, and care must be designed around the realities of their lives. I don't want to tell you more. To share his vision, we have with us, ladies and gentlemen, the founder chairman of Apollo Hospitals, Dr. Pratap Reddy. Ladies and gentlemen, there's something very powerful to you at the Apollo Hospital, always here and always open, ladies and gentlemen. Thank you so much, sir.
would like to launch today. That you know that the time we have all the time. So this is why we are always open and always there. Is the thing, and it happens to be for centuries, for decades. Sunday was considered as a holiday. It's good, everybody needs a holiday. But healthcare is no holiday. Because health is no appointments. There's no good time, there's no bad time. There's no, that it will occur exactly at between 10 and 5 when all the hospitals are open, all the doctors are available. So it can occur anytime. So I think this is where we probably did. We saw that during COVID. We served during COVID, as you know, with 3,000 beds and over 5,000 hospital beds round the clock. So this is where today's event is going to make a significant thing, and I hope many hospitals in the country, or all the hospitals in the country, will follow this lead, and the world will follow it. They followed it, way back in 1990, when we brought the Boeing. I was asked to be on the board. So in the board, I passed a resolution with 6 other members saying that we should stop smoking in Indian Airlines. So that happened. Indian Airlines stopped smoking. Today what happened? The whole world airlines, there's no smoking. So I hope this event that we are taking place today will be like that. Similarly, I did something like casualty. The day before the president was opened up, what all I went through to open the hospital. 5 years of struggle. I came to Delhi first time as a tourist. Second time I came to Delhi to bring this major healthcare service to our people, and 50, 100 trips. But then all that today is behind us. Number of hospitals, Apollo has hospital, good hospital, there are another 200, 300 good hospitals in the country. So all of them are now following this. They all had, previously, the hospital had a board called casualty. So the night before the hospital was to be opened by our President of India, State General Raj Singh, I saw the board. I went to them and they said, what do you mean? The patients are coming to you to become your casualty? So I changed the board to emergency. So the whole world has changed it to emergency. So like that, I think what we need is to think saying, we are in healthcare, and people should trust us. To be enabled for them to trust us, what can we do to make things better? I'm happy to say the journey of 43 years has been very, very, makes me happy, makes me strong, saying that, today, no Indian need to go abroad. I think I must have told you before, I'm a cardiologist. I came back from US, and when I came back, I could do everything that's possible in cardiology. But if we need to pay, the cardiologist can do only so much without intervention. Today, they can do intervention and do so many things, but at the time intervention was not available. Only surgery was available. But people who needed that, very few could afford it. And I told the then Prime Minister, there are only 1 or 2% of the people whom the government and the rich can afford. But all other people are unnecessarily succumbing to this cardiac problem. And that's only cardiac is only one problem. But we know now today, oncology is the biggest problem. But in all of these, I must thank, yes, they all say my daughters. It's not my daughters at all. It is a management team. It's the entire 125,000 of our family members and the 300 other good hospitals who made this huge transformation in healthcare so that no Indian need to go abroad for any treatment.
Apollo is getting into the whole digital piece. Apollo is getting into the AI piece. We are using the power of technology, we are using the power of worldwide and global knowledge to develop what is called the CIE. CIE is the Clinician's Intelligence Engine. ஸோ நீங்கள் நிறைய சிம்டம்ஸ் வந்து இப்போ கீன் பண்ணால் நீங்கள் இந்த மாதிரி டயக்னோஸ்டிக்ஸ் பாருங்க, மேபி இதை மிஸ் பண்ணிருக்கீங்க, அங்கே போய் பாருங்க. அண்ட் இப்போ இந்த நியூ எக்யூப்மெண்ட் எல்லாம் இப்போ கேத் லேப்ஸ், யூனோ கார்டியாலஜி ஆன்ஜியோக்கெல்லாம் கேத் லேப், அது கூட இப்போ ஏஐ யூஸ் பண்ணி இன்டெலிஜென்ட்டா இருக்கு. இதை மிஸ் பண்ணா இந்த மாதிரி பண்ணுங்க, இங்க பங்க்சர் பண்ணாதீங்க. ஸோ யூசிங் லாட் ஆஃப் டெக்னாலஜி to see that this misdiagnosis, this late diagnosis, we're trying to avoid that gap. And that is, I think, the best thing healthcare can do. நிறைய வாட்டி you know, I've been asked this question all over the world. They say everything is becoming AI, and you know, so what are you people going to do? What is the dependence? I always say that there is high tech. You need high tech. We have to absorb high tech to do something better. But we can never go away from high touch. And high touch is the intelligence of the doctor, the hands of the doctor, the way they diagnose. So if you take high tech and if you take high touch and bring it together and say, I'm doing this to serve people and the public, I think we've done a great job. I want to really thank you all for being here. You know, one is, it is a countrywide program, and we've every location of Apollo, 80 locations of Apollo have come together for this, and that is very important. More than anything else, we realize எங்களுக்கு தெரியும், you know, patients இருக்காங்க, அவங்க families இருக்காங்க, நிறைய வேலை செய்யறாரு ஒரு எக்ஸிக்யூட்டிவ் ஹெட் ஆஃப் த ஃபேமிலி. பட் காலையில ஆஃபீஸ் போயிட்டு நைட் வராங்க 7 மணிக்கு, சாட்டர்டேஸும் ஒர்க்ஸ் வேலைக்கு போறாங்க. ஸோ எப்போ அவங்க ஏஜ் பேரண்ட்ஸ் அம்மா அப்பா ஒரு வேலை ஹாஸ்பிட்டல் போகணும், ஒரு கன்சல்டேஷன் போகணும்னா எங்க போவாங்க, எப்படி போவாங்க? ஆஃபீஸ்ல ஆஃப் எடுத்துக்கணும். Same thing, ladies இருக்காங்க, you know, they have to take care of the children. They probably have to cook sometimes. அம்மா பார்த்துக்கணும், mother-in-law பார்த்துக்கணும். And then, you know, so there's a lot happening in households. அவங்களுக்கு நம்ம எப்படி ஹெல்ப் பண்ணலாம்? பிகாஸ் நீங்க ஹெல்த் கேர் போஸ்ட்போன் பண்ணீங்கன்னா, ஏதாவது பிரைமரி கன்சல்ட், முக்கியமான கன்சல்ட் போய் நீங்க போஸ்ட்போன் பண்ணீங்கன்னா, அது அப்புறம் நம்ம எமர்ஜென்சி வந்து லேண்ட் பண்ணணும். இது ஏன் பண்றோம்? ஆல்வேஸ் தேர், ஆல்வேஸ் ஓப்பன்னா, யாரும் எமர்ஜென்சில வந்து லேண்ட் பண்ணக்கூடாது. நீங்க கரெக்ட் டைம்ல டாக்டர் கிட்ட போயிட்டு உங்க டயக்னோஸ்டிக்ஸ் முடிச்சா போய் எமர்ஜென்சில லேண்ட் பண்ணக்கூடாதுன்னு தான் சேர்மன் ஒவ்வொரு இடத்துலயும் இது பண்ணணும்னு சொல்லியிருக்காங்க எங்களுக்கு. உங்க சப்போர்ட்டுக்கும் நாங்க ரொம்ப கிரேட்ஃபுல்லா இருக்கிறோம். And I just want to tell you that the team is very committed to this. Every Apollo employee சொல்றாங்க, நாங்க வந்து வேலை செய்யறோம் சண்டே. டாக்டர் சொல்றாங்க, நீங்க சொல்லுங்க, அப்பாயின்மெண்ட் ஃபிக்ஸ் பண்ணுங்க, நாங்க கட்டாயமா வரோம் சண்டேஸ்ல சர்வ் பண்றதுக்கு. Diagnostic areas, technicians, everybody is committed to this. Only because we want to do something for our public, we want to do something for the people in our country. But இன்னொரு point again, you know, we all need to know as Indians, we're all very proud Indians. You know, we want to win trophies for our cricket. We want to set, you know, put rockets on the moon. But more than anything else, we want now the rest of the world, we want the Western countries, the so-called developed nations, to come and see, look, in India, people are doing this. India in the madri nadakudhu. And so if India can do it, you know the problems in the NHS, we know the problems in the US, expensive healthcare, you have to wait for ages. NHS, you have to wait for ages. But here, an institution is saying, don't wait at all, you know, just come. Even if it is a Sunday, we want to come and help you and we want to come and support you. And I think that is why this is truly a visionary move. This is a move which is path-breaking, and this is a move which we're very committed to. So thank you all for being there, and it is so important for us what we're doing today. Thank you.